we've had quite a lot of interest in this workshop. So I guess the proper thing to do is to say welcome and tell you who I am. So for those of you that don't know me, my name's Ifeoma Onyia. I'm the Director of Public Health at Halton Borough Council, and I also lead on research for and on behalf of the CHAMPS Collaborative. This is an NIHR funded role that I have. So I'm not just doing it out of the goodness of my own heart, but obviously I am really interested in building research in local authority. And as a result of that, we've had a number of hub meetings. So the hub workshop today is going to focus on a couple of, if you like, linked themes. And we've got a couple of speakers who are going to cover some interesting topics, and hopefully you've seen that on the invite that's gone out. So I'm just going to skip us through to the, if you like, a little bit of housekeeping. So we'll follow the usual etiquette and use the raised hand function if you want to speak. So the idea will be that everybody who's not speaking will be muted, and obviously cameras off as well, unless you're speaking. That just helps with bandwidth. Obviously, if you've got any additional questions, please feel free to type them in the sidebar so that we don't lose momentum. I've already talked about tweeting, so that's the hashtag if you want to tweet. And I need to also advise you that the event will be recorded. This just enables us have access to it at other times, and we will obviously put it up on the CHAMPS YouTube channel. And I suppose the other thing is try and be present in the moment. I'm a terrible one for trying to do emails and answer phone calls and all kinds of things, but actually you get the most benefit when you really truly focus on the meeting at hand. So I think pretty much you'll be familiar with the format that we have. Obviously, I've done the welcome and introduction. We're going to have a couple of sessions. So we've got Seonaid will talk through something first. She's the workforce lead over NIHR. And then we've got Andrew, who's going to be talking about his experience in Warrington. I'm not going to give anything away. I'm just going to let them talk you through. And then obviously we'll have a breakout session that just will enable us perhaps reflect on what we've heard and think about how that might influence some of our approaches within our organisations, always obviously looking for how we can really build our research approaches. So I'm going to stop talking for now and actually introduce our first speaker. So that's going to be Seonaid. We're going to pop up some slides, and as I say, I'll give her the opportunity to introduce herself, and then obviously subsequently there's an opportunity to ask questions, but as I say, you're encouraged to put your questions in the sidebar as she's speaking so that we don't lose momentum. So over to you, Seonaid. Thank you.
Hi everybody, thank you for the introduction. I'm Seonaid Beddows and I am the Workforce Learning and Development Manager within the Clinical Research Network. So please don't turn off immediately the word I say clinical. I'm going to put it into context because we're part of the NIHR and we're very much focused on trying to integrate research in all our healthcare systems, and it's really important that that captures public health and population health and everything that happens on that level, because obviously that has a huge impact, and it's something that we're trying to build up here. So let me share my slides with you. We've got really a short time to go into everything that I want to talk to you about. Oh, wrong one, hold on. So here I am multitasking and opening the wrong window, so excuse me there a second. There we go, that's the right one. So I'll bring it to the beginning and put it into presentation mode. So I have got a couple of other contacts there at the end, and we'll leave you with that afterwards. But I represent the Workforce Learning and Development team, but I'll be talking about it as a workforce. what it means for you. So really what I'm trying to explain is what the research delivery landscape looks like for you and where the National Institute for Health and Care Research fits into that. So I'm going to start with a bit of context. The National Institute for Health and Care Research started off as the National Institute for Health Research well over 10 years ago now. And it was really, the purpose of it was trying to make the equity of access for research better, because it used to only happen in university hospitals. So it was initially very NHS focused, because that's where the health research was for the Department of Health. Obviously, since then, we have got pretty much every NHS secondary care organisation involved in research. We've been looking at the primary care landscape, and as it became the Department of Health for Health and Social Care, we are also now allowed to join up things much better, and we're a bit behind on social care and public health, because that's relatively new within the past 5 years for us. But the whole point of having a National Institute of Health and Care Research is for the vision to improve the nation's health and wealth through research. And that does come very much into the government strategy for economic growth, because it's not just about health, but it's preventing the healthcare happening. It's trying to prevent people getting ill when they don't need to, if we can do anything about it. So that's a lot of environmental impacts and things around that area as well. It's to try and find the best pathways, the best treatments, the best, the whole healthcare system, looking at it holistically. So by doing that, obviously, we will save the government money if we can do things more effectively, and we can prevent people keep coming back into the hospitals in the first place. So it is very key in the government strategy for many things. It is a huge organisation with a huge remit. So the NIHR works in partnership with charities, with industry, with universities, with local authorities, obviously the NHS, community, and all health and social care infrastructure. And because it's such a huge vision, it's achieved through having different work streams and organisation within, which focus on different parts of the journey. So I represent the Clinical Research Network, which is the delivery mechanism within the system. So we're very much about research that has already been developed and helping answer the question. And we can only answer the important questions if we get enough data to come out with a reliable answer. So that's the part of the system that we sit within, is trying to answer the questions. But the whole organisation, as you can see, lots of people around the table, has a huge budget from the Department of Health and Social Care to do this. A really big focus is upon the inequalities agenda in health and social care. So there's a lot of funding and thought and strategy going into that part of the agenda at the moment. It's about driving the research from the ideas right through to putting it into the benefit for the patients and population and the economy. And they do it through many different streams, as I said. So they have faculty, such as the NIHR Academy, where they train researchers and leaders of the future. They fund research itself, and they do that through many different ways. They have different funding streams, but they also have schools for particular different research that are based within universities to generate that relevant research. So they have a school for public health research. They provide systems. So we've got a public and patient-facing system called Be Part of Research, where lots of research, all the research that's out there that qualifies is on the system, and people can find things to become part of. They have systems such as what's known as CPMS, which is a very dull and boring thing to think about, but it's the mechanism where they register how many people have taken part in research, and we can see in real time how close we are to answering the questions. That fed into the Prime Minister's all his talks when he was talking about vaccination research, for example, during COVID. So we were getting the numbers and how many people from that system. And they also provide infrastructure, and that's where we sit, the Clinical Research Network. But I believe in one of your previous meetings, you've also heard from one of our other member organisations, the Research Design Service. And as you'll know, and you can probably tell from the name, they're very much focused on helping you get your research off the ground, get the right funding, and get it designed and up and running. There's also within North West Coast the Innovation Agency, and they're very focused on getting the innovation out there, so getting the ideas out there and moving things forward in that sphere. So there's lots of different parts of the NIHR. It's a very complex system. So I just wanted to put it out there that the context and the background of it is like that. And I represent just a small part of that system, which is the Clinical Research Network. So we cover the health and social care landscape within South Cumbria, Lancashire, Merseyside and Cheshire. So right down that area, which, as you can see, borders the coast all the way. So therefore we are the Northwest Coast geography. Within our geography, we've got 3 of the ICSs that sit within our region. But it's worth saying that looking to the future, we are government funded, and therefore every 5 years has to be reviewed how we're working. So from April 2024, we will map exactly onto those 3 ICSs, and our Greater Manchester region and our Northwest Coast region are going to come together as one. And also to reflect better what we do, we're going to be renamed as the Research Delivery Network. So as I say, don't be put off by the red herring that we're called the Clinical Research Network. It's the context and the background of where we came from that it's about that. It's about all healthcare research in all arenas on there. So within ourselves, we cover 31 healthcare specialities. It pretty much covers all the different disease areas you can think of. Also includes social care, primary care, public health as separate specialities as well. And within our network, we fund people in all various different positions. So as Ifeoma has already mentioned, she's funded by us to try and really get the public health research going in our region so that we can work together. So there's all sorts of things that we can do. This is a very broad breakdown of it. But although we're in the research delivery sphere, we can help from the concept of it and the planning of it, because we have experts in our region from all various different things. We are a network, and therefore we've got an overview of things that are going on within our region. So we can help with designs to see if it's going to work, if we're going to be able to get the numbers that we need to answer the questions, to help you plan how to do that. What we do for a lot of our research is try to find sites, either existing or new contacts. And because we're a national network, we're one of 15 local CRNs within England. If you had a piece of research that qualified, it's not just the Northwest region that you'd be looking at. We can help you, put you in contact with other regions across England to get the numbers up for getting the answers to questions. We can advise you on how to set up sites, advice on permissions that you might need to do, put you in contact with people, help that happen. A central point of contact per se within your region. We do also have some national accredited training in all sorts of areas. So the research context, the research design, the community building, that sort of thing. And it is something that we're going to be working with you on to provide further, I say training, it's more about a conversation and helping support you with your way forward and how to do it. So we're going to be putting on some further workshops for you in the coming months. There are some support costs that may be valid, so that there's little bits of funding here and there to help with the infrastructure of delivering research that might be relevant for you. Sometimes we're able to provide staff, whether that's people that sit within your team, or we've got a agile delivery workforce that can come out and help collect data on studies. So dependent on the study and the capacity and what's needed, there may be support around that. We help with study performance, i.e. making sure that you get enough data to answer your question. So it's known as recruitment to time and target. So if you're actually recruiting actual people rather than looking at various other systems research, then it's making sure that we're going to have enough answers to the question to come out with something that's reliable at the end of it. So we keep an eye on that, and we look at different ways of doing it. If we're not getting enough things in, is there another way that we can do it? Do we need to change your strategy? So we can help work with you on that. And once we do have results, it's really important that they get disseminated so that the evidence can be used in practice. So we work on that as well. And obviously a lot of the things that we do feed into NICE when it comes to the NHS, but also there's a lot of the studies that have been fed back to government for other policy areas as well. So there's all sorts of things we do. We've got particular things like the Research Ready Communities pilot that took place in Blackpool, and we did a co-production with young people, and they went out and mapped their community to see what the health inequality gaps and the needs were within their region, and then that way that helps look at what research is needed and what we can do to have an impact in our actual local community. So we're doing more projects like that as well going forward as well. So that's a very whistle-stop tour of the things that we do. But I think something that's come up before that may well have been touched on is the research that we put our money and efforts and support into is research that is on something that we call our portfolio. And that is where the government has a set of standards that makes the research reliable, that's worth the funding with taxpayers' money, essentially. So we call it the portfolio, but there's specific eligibility criteria to become a portfolio study. And we can help you with that. And I've got a couple of slides going forward on if you've got ideas and you've got research that you would like to be funded or to go on the study, go on the portfolio so that we can support you in it. I'll tell you a little bit about that in a moment. But the other part of that is that you don't have to be a researcher with a study. It might be that there are studies already out there that you'd be able to help with. So maybe, that it doesn't have to be that you have to run the study. It might be that you just would be able to help deliver a study or collect the data that we need or get involved in it in another way. So there's two different things that we can help with there. When it comes to eligibility, first of all, it needs to meet the definition of research, which essentially means that you've got a hypothesis. You've got a question that you want answered. Is this going to make a difference? If we change that, would that have an impact at this place? And it needs to be something that there hasn't been answered before, obviously, because it's an unknown question. It might be building on research previously, but yeah, it just needs to be a research question rather than a service evaluation, for example, to say if this service works. It's more about asking a question that's new. It needs to have appropriate ethical approval. And when I say appropriate, not all public health research would require the ethics approval in the same way. But as long as the approval that is needed is there, then that is what we're looking for. It needs to have been reviewed essentially to make sure that it's ethical. We must have full research funding for the entire project so that it doesn't get halfway through and then we never get to an answer because we've run out of funding. So we just need evidence of that. And part of that process is that it has also been peer reviewed to make sure that it is of national importance, whichever the question is that we're looking at. Often that peer review is achieved through a grant application. There is a link there to the Department of Health and Social Care document that tells you about that, if that is something you're interested in. It's probably quicker just to get in contact with us and ask us if you've got any questions on that. But there is a document if that's the type of thing you like to go and have a look at there. Now, what does this look at like locally? Well, we've pulled out our performance in public health over 2022 and 23 within our region. And we've had 371 recruits to public health studies within that year. Well, within this year so far, so that's since March. Out of our 15 CLRNs, we are placed 7th, so about halfway down at the league table of the numbers in terms of numbers that we've recruited to. That has actually come across lots of different areas. So it has included recruitment from NHS trusts, 4 universities, 4 local authorities, 2 charities, 7 hospices, 3 care homes, and 20 GP sites. So within those 3 studies that have been recruiting in public health in our region, it has been quite far-reaching, the various areas that we've reached for that. So that's where we are at the moment. I'd love to think in 2, 3, 4 years' time, that's going to be 20 studies or, you know, in all those different areas. You know, it'd be great. Maybe 20 studies is a bit much to have going at the same time, but it would be great to see more of this in our region. But it's really encouraging that we already have things going on that we're linking it with on that. So these are the 4 studies that are current. Now, my colleague James knows a lot about these. Are you on the call with us, James? I know he said he might be here today.
I am, Seonaid. Hello.
Do you feel, would you want to tell us a little bit more about these? Are you comfortable doing that? I know I haven't just put him completely on the spot. We did discuss this before the call, but
yeah,
I can't see you, so it feels a bit funny.
No, don't worry. I mean, to be honest, the majority of the information that I can talk about on the slides, but, you know, if anyone's interested in a bit more information, I'm quite happy to send studies over just to have a little look at. So these are just a couple of examples of studies, like Seonaid said before, that we have specialties. So these 4 studies are badged as public health studies, so quite relevant to what we're talking about. So the first study that's on our list is reflective fostering, so an intervention to help improve the well-being of children in care with the foster carers and, you know, improve their overall outcome. And so one thing that's really interesting is we've got 2 councils in the North West Coast, so Lancashire and Wirral, and Lancashire County Council are the highest recruiters. So it's shown that, you know, it's a really valuable study. Hopefully this is going to roll on to a larger study from when we were talking to the study team in the future, so more councils can become involved in future studies, so that's one to look out for. The second study is MapMe, so this is a intervention study around weight and obesity in children. We've got 1 council who are involved at the moment, Sefton Metropolitan Council. I did contact the study team to ask about future more sites, but unfortunately they've reached their cohort of sites that they're looking into. So this is actually MapMe 2, so hopefully they're looking for a MapMe 3 study. So this could be another one that if people are interested in finding out a bit more about, that we can look into that. The third study is Anchoring on the Coast. This is a Blackpool-based study, so it's linking in a lot of stakeholders from the Blackpool region to talk about health inequalities. So it's mainly questionnaires, interviews, and focus groups. So it's really bringing lots of different parts of the community in Blackpool together to be able to come to quite a unified decision to see what the health inequalities are, and then develop more research based on that area, which I think is really important. So that's something that could probably be replicated in other regions as well. And finally, even though I've put 3 twice, I don't know why, is the ELSA study. So this is a surveillance study for children to test for type 1 diabetes, age 3 to 13. So I'm not medical, so I'm not going to try and tell you how that works, but it's basically a finger prick test. If children are found to have positive antibodies for type 1 diabetes, there's an education package of, looking into symptoms and what to do if that happens. So one thing that I think is really interesting is this study can be recruited from lots of different sites, which is what we're trying to show in the NIHR. So it can be from GP practices, pharmacies, schools, home testing, that kind of thing. So yeah, I think that's one that's going to be up and coming very soon. So that's one to look out for. So when it does come forward, we'll be able to send that out to everyone and see if anyone's interested or pass on to colleagues. And I think that's pretty much me, Sean.
That's great. And just in case you haven't worked it out, James runs a matchmaking service for studies and people interested in studies. That's essentially what it is, isn't it? It's trying to find what you as an audience want to do research and what are the areas of interest that you have. What do we have that we can offer you that you can support within our studies? So I think if you're interested and you're not already on the list, James and his team would happily invite you to show an interest in any studies that we have coming forward and going forward. So as I say, it's not that that we're looking for you all to have your own studies that you're starting and getting the funding for. A lot of the studies we have already have been through that process, but are looking for people to collaborate with, people that can help them answer the questions and get a good demographic, really, the wider demographic rather than just one team looking at it, getting teams from all over the country looking at it in different areas. So it's really important to get involved in the research that's already happening as well as developing your own research. Is there anything else that you want to add while you've got the floor?
And to be honest, it was just like you said, Seonaid, if anyone's got any ideas or they're interested in being involved in kind of research studies, be in touch with us. More than happy to have discussions about anything, really. And no matter how small, really, it's quite happy to help in any way that we can.
Excellent. Okay, so just moving back to the slides here. I am obviously workforce learning and development. So just to let you know about some of the training pathways or development pathways that there are within North West Coast, within our region as a clinical research network. We have some local pathways. We have the early career research pathway. I do apologise, there are an awful lot of acronyms in research and I'm trying my best not to use them all and let you know what they are. But early career research pathways. So we have one that just started and it goes every year for mainly for nurses, midwives, allied health professionals, and allied health professionals include social workers and other registered professionals and other healthcare pathways. We have a scholars program, which is more about the healthcare leaders in the region. Majority of them currently are medics, but that is open to applications now at the moment. That's a 2-year program, which gives you protected time to work and research, and it gives you a day a month talking through how to get your research idea off the ground, how to apply for funding, how to pitch it, how to get people on board and that sort of thing. There's also on a national level, the NIHR has fellowships that are particularly focused towards local authority. We've got a pre-doctoral and a doctoral local authority fellowship. There's also the LA Spark, but I won't say anything more about that because Andrew's going to talk about that, I think, a little bit later. But we have got the link there for you. We also have a national system that has webinars and face-to-face learning on it that you can have access to for free if you have a government or an NHS or an academic email address. That's what you need to sign up for it. And on there are certain communities. The public health community isn't really off the ground yet, but I know that there's a plan to have a specific public health community on there. But there's things about the background of research, how to deliver research, and things about building communities and that sort of thing. So, and also leadership modules and things. So there is a lot on there to explore, but we hope to be adding to that over the next year or two as well for things that will be particularly of use to you as a community. So thinking about if you do want to go ahead and get your own research off the ground, there are lots of funding opportunities for that as well. I've put some links in for that, a whole lot of wonderful acronyms at the bottom there. Public health research, health technology, the HTA, the health technology applications, can't quite remember, research for patient benefit, and they're all England only. But that website above shows just how many there are. I'm not sure if this will take you through because I'm showing a window and it's a bit slow. I'm not sure. Can you see that web page or can you still only see the slide? Anyway, it's the link
slide.
Yeah, I think because I've shared the slides and not my whole screen. Sorry about that, but the link's there for you. There's lots there. It's on our NIHR. If you put NIHR public health funding, it should come up with that link for you anyway. But it's not just ourselves as an organisation that fund research that would be valid for our portfolio. The research councils, Innovate UK, Research England, charities, charity funding counts. There might be international state funding, European Union, for example, maybe not so much anymore, but there is things that we can get involved in and share and collaborate on. You could apply to industry for it if it was something through that area, something with private funding or government funding, as long as that's been won through competitive processes. You know, some of the local authority funding pots are valid if it's for a specific project. So there's all sorts of ways that might work there. We do have a list of partners, but again, talk to us. If you've got queries on it, we're quite happy to answer them. Just come and talk to us. I've got a whole lot of links there that might be of use as well, because I think these slides are going to be shared. The NIHR School for Public Health Research has got lots of links and position documents and research that's coming up and all sorts of things there. The fellowship programs I've got there, I've got the link for again. Our local research delivery strategies on there. Your Path in Research is going at the moment. There's a great website with examples of people that have got involved in research and how they've done it. Definitely recommend going and looking that up as well. But that's it on my whistle stop tour. I will be able to talk to you a little bit more about these things in much more detail at a later stage. So, any questions at this point? Or have I just totally given you too much information all at once?
Can you hear me?
I can hear you, yes, yes.
Yeah, okay, cool. So there are a couple of questions in the sidebar, one of which you've probably addressed already. It was, are you looking at the drugs and recovery sector? So that was when you were talking about the portfolio. And there was a second question about, are there any public health training routes for people who are maybe working within health and wellbeing in the voluntary sector? And just to say that it was slightly behind time, and then I'm going to invite Judith just to come in and ask her question, and then you can perhaps take all three. Okay, so Judith?
Yes. Can you hear me now?
Yes, I can hear you.
Yes,
fine.
You can.
Hi.
Good. I'm saying that I can't ask a question. I have questions I want to ask, which I'd have put into the chat line, only there is no chat line for me.
Ah, well, that's fine. I'm here. You can ask me in person.
But do you want me to go ahead now?
Yes, absolutely.
Well, I'm very interested in the program that's used a great deal for CBT in mental health, as if this was very successful. The people I know who have done this, access to what's the acronym for it? the Access program anyway, it's not actually been successful. What I want to ask is, how many people have gone through this? How many people have found it useful? How many people actually withdraw from it before it's completed? I think typically they get 6-hour-long sessions. Is that adequate to deal with everybody's amazingly complex problems these days? And what is the feedback? How is it? I mean, you're supposed to be addressing things through sort of collecting information and using it, and I don't think it's happening. I don't see any feedback. I don't see any feedback on how successful this is. It's just sort of assumed that it's successful. So we go ahead and lots and lots, thousands and thousands, millions are being spent on it. And I doubt it's successful.
Judith, that's a really important question, to make sure that the interventions that are being delivered in mental health are valid and working. And there's a huge range of research questions out there looking at the various different interventions and comparing all sorts of things. The Be Part of Research website might be a good start, but there's also NIHR evidence, if you want to look that up, where you might be able to drill down to some of the CBT questions. And if you've got specific questions that you'd like to set up studies for and ask, then going down the route of trying to get some collaborators and fundings in to answer those very important questions are very important. So this is what the NIHR does. We ask those questions, we get the funding, we try and find the answers, and we publish the evidence. So it's a very specific area there, but there is things out there that we can follow up on for that. So by all means, if you want to drop me an email so that I can help you find those questions and guide you to where you want to do with it, that's great. But it's probably a conversation that will take too much time to continue on the call today. But I'm very happy to pick it up with you at a later stage. And just the question about whether it's about drug treatments. Certainly, that's one of the areas that we look at, but it's just a very small part of what the NIHR looks at. So yes, we do have drug trials up and running, but we have a lot of other things that we look at as well. From one of the public health questions that we looked at a couple of years ago was whether doing a dental check on children and coming into reception was a good way of capturing and preventing the amount of carries that was going on. So there's all sorts of things out there in all sorts of arenas. And yeah, we cover it all, really. If it's to do with health and it needs an answer, then it's something that we would be on our agenda. Was that all the questions? Okay, so have I missed any?
Sorry, what I'm going to do is I'm going to invite Andrew to do his presentation now because of the time we've got, but then we'll come back and address some of the questions, in particular the one on drugs. So Andrew, over to you now. You've still got the same amount of time, so don't worry.
Mine's short and sweet, so don't you worry about time. I'm going to fly through it and then we'll have a nice discussion afterwards. If I can find my slides. Okay. Can you see those slides?
We can, but they probably need to just be made a bit bigger.
Like that?
Fantastic. Great stuff.
So thank you thanks Seonaid and James. Nice to see you again, James. So I'm Andrew Riley. I'm a researcher, a PhD student from the University of Liverpool. I'm studying I'm doing health services research, and I've got a studentship through the NIHR ARC Northwest Coast. But I'm not really talking about that today. I'm talking about research partnerships in Warrington and the NIHR Local Authority Short Placement Award for Research Collaboration. And the focus of this was developing collaborative practices between the local authority and academia. I'll start by providing a bit of background to myself, then talk about the placement itself, then about what we found, and then some of the outcomes from the placement. So as I'm doing a PhD, I've got to take every opportunity I can to talk about my research, which is entitled A Mixed Methods Comparative Case Study Evaluation of a Community Health and Wellbeing Worker pilot in 3 settings in England. The community health worker model itself has been adopted from one that's used in Brazil, in which lay health workers provide health education, health promotion, well-being and signposting services to people in their homes and in the community. It's a universal offer, open to everyone in a specific geography of around 150 households. It's regardless of expressed demand or need. It's comprehensive in that it's inclusive of all age groups and health conditions, and it's integrated, so it's linking into community and primary care health services. In Warrington, it's being implemented through Bridgewater Community Healthcare Trust. In Westminster, in Pimlico, through the City of Westminster, linked up to a GP clinic, the Marvin, linked up to Imperial College London as well, and then in West Yorkshire in Calderdale through Healthy Minds, which is mental health charity. I'm going to be looking at what's implemented in each context, in each locality, to see how they differ, see what the similarities are, think about the reach, the fidelity to the model. I want to assess the feasibility of this model, the acceptability of the model, and then identify any kind of processes and mechanisms that facilitate or impede the delivery of the intervention. So this is my starting point as the PhD, and then the placement was building on this, linking into Warrington, wanting to have a better understanding of Warrington as a context. So the Spark placement, the Le Spark placement, started last year. It's a pilot scheme, and it's designed to support short placements for individuals to move between practice and the NIHR in order to enhance their career by developing the skills, knowledge, and expertise to work at the interface between local authority and academia. It supports individuals based in local authorities who want to take short placements in the NIHR or affiliated universities, and vice versa, so people in the NIHR and universities who want to spend some time in local authorities. It provides academic training, it helps to develop research capacity, career development, and generating networks and partnerships. Applying for the scheme, I had to identify a placement host in a local authority who would provide some supervision and support for the role. I had to put together a bid which was fully costed with outputs and objectives to be completed during the duration of the placement. The Director of Public Health in Warrington, Tara Raj, was eager to get involved with the project, so we put together a bid in which I would learn about the local authority's work and also support the authority in identifying opportunities for them to become more research active. We agreed that I'd work over two and a half days per week over 4 months, and that was in the summer this year. And I'd be working on 2 different strands. The first of these work packages was contributing to a new population health management pre-frailty intervention, which they were just setting up as I joined the local authority. And this was bringing together different providers in the area, including GPs, the NHS, other branches of the local government, to proactively identify people at risk of frailty and offer them targeted support. The second strand was putting together this report outlining opportunities for the local authority to become more research active in collaboration with academia and other research bodies. We're looking at opportunities across 2 directorates in the local authority, so that was public health and environment and transport, to demonstrate that the research could be embedded across the council at large. The aim of the work was to identify some case studies that could illustrate what successful collaboration looks like, and then to produce a bank of resources and contacts that the authority could use when it wanted to instigate research projects. And then we decided that the objective of the work was to inspire and inform. Going into the work, it was helpful to find that some research, some investigation in this area had already been done. So many of you will have seen some of this data before. It was compiled and presented by Dr. Nia Coop, who was working a few months back with Ifeoma as a research fellow, looking at the same question, but across the whole Cheshire and Mersey imprint. It's useful to look again at this, I think. The NIHR at the time, so this was in 2020, it was a public health research funded programme that was looking at 14 sites across the UK, looking at barriers to those local authorities engaging in research, and then what they did to facilitate it. In terms of barriers, these were characterised as both internal and external to the local authorities. They included factors such as competing and contrasting priorities between the local authority and universities, a lack of understanding about processes for applying for research funding, limited time, resources, and a lack of research systems and structures within local authorities, including processes for ethics and governance. Having access to this data, to this work, was useful for thinking about possible issues within Warrington, for framing the conversations that I was having with informants in the local authority and other organisations. And then this was kind of indicative to me at the time of the movement within the NIHR. So recognising that there is appetite within local authorities and then wanting to find solutions to facilitate and support this. So in the work, over the 4 months I was with Warrington, I spent a lot of time talking to people. And that was seeking to identify some of the specific challenges and some of the issues within the Northwest, and then trying to identify opportunities for developing relationships, research networks for Warrington. So I spoke to people in other local authorities, to Ifeoma, Wigan, Cheshire West, Halton. I spoke to people at Liverpool Health Partners, Bristol Health Partners, a number of other academics and universities, surveying them, and then a number of people within the NIHR network. So that was learning about the clinical research network, speaking to people like James, going to the research design service, and then some of the team at the first network, so the public health intervention responsive studies team, who were there to help local authorities when they have something that they want to investigate, a research project, an evaluation that they want to do, so they can support that piece of work and produce the kind of evaluation and research that they would want. So I'm just going to finish by looking at 3 main outcomes from the research. The first was about the public health team itself and just the work I did with that team. So I did 3 focus groups with the public health team and interviews with members of the Environment and Transport Directorate. The focus groups were very well attended. They were very positive. They were very engaging. There was a lot of interest within the public health team in getting involved in research projects. There was a lot of pre-existing experience and skills within the team and motivation to develop their own evaluation and research projects. We did produce quite a long list of potential research projects that the team will be interested in getting involved with. Barriers existed, of course, and these were primarily to do with time, finding time to do the work alongside existing responsibilities, the time it takes to develop and run research projects. But we came up with solutions, and these were things like providing protected time for developing and working on research projects, encouraging participation with local research organisations like the Northwest Coast ARC, producing a crib sheet with guidance and about research theory and methods. Another positive outcome from my point of view was learning about the NIHR network and the infrastructure and all the services that are available within it. So this was across the wider nationwide infrastructure, so the CRN, as we've heard about, the RDS, and obviously the SPARK scheme. But thinking more about the synergies with more local groups, and particularly the ARC Northwest Coast. So the ARC has a number of subgroups, research groups dedicated to developing research projects and bids. These focus on things like social prescribing, mental health and well-being, digital healthcare. They welcome participation in these groups, and the research agenda, the bids, can be shaped by the participants. Warrington were obviously aware of the ARC, but they weren't participating in any of these groups. They weren't members of the ARC at the time, and so that seemed like an easy win, something that needed to be, and 2 groups needed to be brought together. And then the third outcome, and I think this is probably the most important, is that relationships matter in all of this. And so this refers to the need for open and frequent dialogue between academics, researchers, and local authorities, so that research ideas have the time to develop and grow. And a really valuable way of doing this is through research champions, the research champion role. And I know this is something that Ifeoma was setting up through the CHAMPS network in all of the local authorities in the region. And then also through things like researchers in residence role, where academics can be brought in over longer periods to support and lead on research work and to provide a critical eye that you do in local authority. So that's all I wanted to say, really. And then what I wanted to do as well was to open up the conversation to see what your take is on all this, and particularly what your ideas are in terms of developing these relationships, maintaining these relationships over time. Thank you.
Yeah, thank you very much, Andrew. That's really informative, and I'm really pleased to see that some of the work, the early work that Nia did, actually fed in and influenced how you approached this. So I'm just going to slightly reflect on what we've heard thus far, because we've heard from Seonaid, who's been able to give us an overview, if you like, of some of the opportunity that's available from NIHR, and previously we've had other speakers who've talked about things like the RDS and how that can support research. We've almost helicoptered in and gone closer now. We've actually talked about your unique experience within a local authority setting as an expert, I would argue, coming into local authority. So the next bit now is, how do we grow our own experts from our local authority public health teams to become much more involved in research? And I know some of the people on the call already are, and there are examples of that, but how do we make this so that it's much more common and normal? And I certainly think that some of the training that Seonaid described that's available might be quite useful opportunities, and certainly some of the opportunities that are funded, like the LA Spark role, quite useful as well. So we've said that we're going to have some breakout groups, but before we do that, and I know you've posed some really useful questions, there were some questions that people have asked in the chat. So the first one was really, Seonaid and James, whether you could share your contact information. And I don't know, again, Andrew, if you'd be willing to share your contact information so that people that want to follow up can do so. We certainly know that slides will be shared after this. As we've already agreed, there'll be a recording of this so that people can come back and look at it at leisure. And then I just wanted to clarify, the question about drugs was about not so much drug treatments, but access and support to things like people who are already in treatment because they are on drugs. And is there any research into sort of drug recovery, etc.?
Okay, it's certainly an area that falls within our remit, and I've got to say I have no idea, because it's not my area of expertise, what evidence there is already there. I do know that I help support a researcher with a grant bid to look at end-of-life care in the homeless communities around Liverpool, and there's certainly lots of settings like that. I think there was also one that was looking for grant funding within Manchester that was going to be going national, that was to do with drug recovery, and I can't even remember what the context of it was, but it's certainly something that's very valid and something that's very much on, falls within our remit. I don't know what evidence has already been gathered, but it's certainly a topic that falls within our remit. We can certainly look and see if there's anything going on at the moment you can get involved in. Alternatively, if it's something that you feel passionate about and you feel that there's not enough evidence in a certain area, again, we can help you do something about that and collaborate with people to answer questions. And thanks, James, for putting in your research details. So I'll stick mine in there as well, my contact details, emails, I mean.
Okay, so we've got a couple of hands up, so we'll take those questions before we move into the breakout group. So I apologize, I don't know quite what order they came, so I'll take Donna and then Frances.
Hi, good afternoon, everyone. Can you hear me?
Yes, perfect.
Yeah. So my question is, my name's Donna Williamson. I work for Forward Trust, which is drug and alcohol recovery service in Liverpool. Although Forward Trust are a very big charity, they're right across the country, heavily involved in the prisons and in probation. So recently we had 6 trainee doctors come to our service looking at our model of recovery. So because, you know, doctors, they work with the medical model, and, you know, as a charitable sector, we work with the holistic model. And there seemed to be massive gaps in what the medical model is and what the holistic model is. And considering that drugs and alcohol play a massive role right across the health sector, in the NHS, in hospitals, into mental health, emotional health and physical health. And doctors actually get, from what the conversation we had, they get half a day training on what addiction is. And that's absolutely ridiculous when addiction is everything: heart disease, diabetes, mental health. So it seems to me that there's massive scope to do a great big research project on how the model medal and the holistic medal might come together to save people's lives.
Well, thank you very much for that, Donna.
Okay.
I'm going to take the question from Frances, and then I'll ask Seonaid just to respond.
Oh, thanks, Ifeoma. Mine isn't a question as such. Mine's just to advertise the Spark placement, because I think we really, it was such a fantastic opportunity, because it really is being able to identify a distinct piece of work and somebody come in. It's the things that you never have time to do yourselves, the things that you always think. I mean, a bit like the research hub now starting up and everything, all the things that for years we've thought, wouldn't that be great? Wouldn't that be great? And I think also, if it's one of these things, if it's thought through and you get somebody like Andrew, who is just an independent, can work independently, obviously somebody very experienced, you know, given the brief, goes away, it isn't a great pull on our time, and Andrew certainly wasn't. So I can only talk about our experience, you know, and then you come out of it with, you know, a piece of well thought through work that you can then take forward with, I shouldn't say this, I mean, I'm sure Tara would go, you know, with quite, you know, sort of it's a win-win situation, I think, as I say, and it is, and sometimes it's people think, oh, we haven't got the time to provide the, you know, the time and the resources for the supervision, etc. But that wasn't our experience at all. It was, you know, it was a really, really positive outcome. That was all I wanted to say.
Checks in the post, friend.
So I think that's some really useful feedback, and it really helps to make the way for the next session. So there's something that's been pointed out that potentially could go on the portfolio in terms of an approach to drugs and recovery, which I think is excellent, and I'd certainly be interested in seeing that go on, because in local authority we actually have a burning imperative now around combating drugs and improving treatment pathways. So I'm going to ask for some support now from our CHAMPS team, so that we can break out into the little groups. And I've put in the sidebar in the chat in rather large text what I want us to consider. So really, it's a catch-all from the 2 presentations that we've heard. What can you use from this within your own organisations, particularly thinking about the opportunities perhaps that Andrew's outlined, the opportunities that Seonaid's outlined in terms of some of that training, etc., and think through what are the opportunities that you've heard, but also what additional support might you need in order to benefit from them. So very shortly now, you'll be whizzed off into little rooms. You have about 10 minutes within those rooms. Please identify one person who will be your feedbacker, if that's the word, your feedback, your spokesperson, and we will be taking feedback from you around about 12, 13 minutes past the hour. Thank you very much. We've all sort of flowed back. Some of us really interesting conversations that we were having as well. So how many groups did we have all together, Tracy?
We had 8, Ifeoma.
Okay. I'll be honest, I think I saw that I was in group 7, but it was a fleeting thing, and I didn't necessarily see that for too long. So I'm wondering, do we have anyone from group 1 who'd like to just give us amazing technology? Sorry, I got thrown out briefly. Yeah, so is there anyone who's in group 1 who'd like to just give us an idea of a couple of the opportunities that they thought they could use in their local area? Who was in group 1?
So hi, it was myself, Jerry, and another colleague who was in group 1. We're both from CGL, from Change, Grow, Live. I'm from the Will Service, and I've forgotten the lady's name now. Terrible.
Never mind.
Yeah. My colleague was from the East Cheshire service. The conversation that we had was that we're not able to instigate any kind of research at our services because all that is taken, all that is done centrally at our head office, if you like, where there is a team that conducts research and also approves any kind of research proposals that come from external sources such as universities and the like. So unfortunately, on this occasion, we can't provide anything more than that in terms of feedback to yourselves.
Okay, that's interesting. Let's hear from another group and see, because I think reflected on that, there was a similar sort of discussion in my group. So who is there that was in group 2 that'd like to feedback, perhaps about the opportunities and then also about what might help support that?
What is you doing? Come here.
Oh dear. Anybody from group 2?
Andrew, I think that might have been us.
Sorry, I didn't realize which group we were in.
Yeah.
We focused more, I have to say, on some of the barriers rather than the opportunities, some of the challenges of sort of linking into research. So, Susan, I mean, please come in and correct me if I get some of this wrong, but so Susan was talking about the fact that they're already linked into JMU, some of the universities in the region. They have research projects on their books, but often they don't have much capacity within the universities to develop the research opportunities that they would want. So she's working in violence reduction in Merseyside, so trying to get that onto their books, trying to develop violence reduction kind of research projects would be something of interest for them. For others, they're new to the region, so it's very useful hearing about these opportunities and wanting to take them back to the departments to see how they're going to link in and fit into what's on offer within where they're working. It was also pointed out that the NIHR website sometimes isn't easy to navigate, and there's limited capacity within local authorities to get involved with research projects. You know, you've got a lot on your plate. So, you know, at the end of the day, when you sort of finish work, do you want to sit down and try to get through those websites, try to work through a Spark placement application form? It's a challenge, isn't it? So, I mean, my response to that was, at my end, within the universities, I think there needs to be greater promotion there as well. So, you know, the opportunity for Warrington was for me to come to them, to offer it to them, and then it's win-win, isn't it? You know, I'm taking the heavy lifting in that. So I think personally, I think there's a gap, something that needs to be promoted more within universities in the region.
Okay, thank you. Anybody from group 3, and I recognise that not everybody may have seen which group they're in, but anyone from group 3 able to feedback?
You know what? I've no idea what group we were, but if I feedback, then our group's gone.
Okay.
I'll go down, if that's okay.
That's fine.
We had Fran in the group with me as well, and not everybody got a chance to speak. And Michelle from St Helens, and Wendy, and oh gosh, I'm really sorry, I can't remember your name because I haven't written it down, and knew there was person that didn't have a chance to speak. But where the conversation went with us in our group was that Michelle, for example, in St Helens said that they're really keen. They've got lots of people that are really keen on research and they want to do more on research, but what they struggle with is the how. How do we do that? Okay. We talked about how obviously the information I've given you, there's loads of suggestions, but it's kind of two extremes, isn't it? It's like you can take on research that we've got on the portfolio, but when we break it down, actually there's only 4 studies and only one of them is open to help at the moment. So we're in a position where we need a lot more research on there that we can offer other people to get involved in, because if somebody else has already been through the grant applications and the designing it and whatever, we can get involved without having to do all that heavy work. And what Wendy was saying was actually, you know, the other thing that can be overwhelming is there's so many topics that we're interested in. Where do we start? How do we break it down to just one thing? And ultimately, I think the biggest barrier is maybe actually time, resources. You know, so Fran was saying how useful it was, obviously, having a Sparks placement coming in and picking up that idea that they'd formed. But what about using students from the universities that are working in public health and need to do a project as part of their studies? It gives them a placement, it gets them to see how things work on the ground, and it would give you an extra pair of hands to do a project if you had projects together. So obviously that's out with the NIHR, but there's other methods where you might both be able to get people involved in research and get some work done for yourself in an area you're interested in. But I think the how and the opportunities and the time came out as the biggest barriers. And please,
that's really helpful though, because within our group, and I'll just sort of jump in so that we're out of the mix as well. We talked, obviously, some of the constraints included that thing about no dedicated time, and we also talked about a lack of funding. But then there were also some opportunities about, yes, there's the opportunity about the ARC, but there's maybe other opportunities using the research hub to link in with other organisations, the likes of which in our group included LGMU. And thinking through how do we better link, and that overlaps with the point you made about how can we perhaps get research students in to local authority. So I'm going to invite group 4 or 5 to feedback now. Anybody from group 4? Or anybody that's going to feedback?
Hi, Ifeoma, it's Steve here. I'm not quite sure which group Lynn and I are in, but Lynn's in the public health team in Cheshire, West and Chester, and I'm Population Health Workforce Development Programme Manager for CHAMPS across Cheshire and Merseyside. We talked about the challenges that are faced by public health teams in terms of probably more about the barriers, the fact that a lot of teams are not at full capacity for whatever reasons of employment restrictions and employment freezes. So it's really challenging to actually have capacity for research, and also that sometimes evaluations of programs which are done by academics are perhaps not done as quickly as we might need them doing for our sort of program management perspective and business planning, and it's whether there's a need to use the sort of universities to almost identify bigger problems than just doing an evaluation of a program which might be focused on a particular topic. So actually, we talked around the issues around the cost of living crisis. Obviously, there's the poverty truth issue in Cheshire West and Chester, and some things I've been looking at around sort of Marmot and making every contact count. And it's maybe we need a little bit of brainstorming, thought, whatever you're allowed to say these days, around actually getting to the nuts and bolts of a meatier topic, and then getting some academic research out of that could then produce opportunities for people to develop interventions that so almost like a real world problem is being identified by the practitioners, and then academics come up with a potential solution for that. So yeah. I think that was more or less what we talked about in our group. There was only two of us, so we did get a chance to speak.
Thank you. Again, reflecting on what was discussed in the group that I was in, cost of living came up as well in our group, and certainly seems to be an area that, again, I know back in work is absolutely paramount at the moment. And yes, there are lots of interventions that are being put out there, for example, warm hubs, but what's the evidence they work? So yeah, it's an interesting one. So is there anybody else who wants to give back the final bit of feedback, because we're drawing to the end of our meeting today, and I don't want to just stop people if somebody's got a burning issue they want to raise that hasn't already been covered by others. Okay, I'm going to take silence to mean that we've pretty much covered most of the issues. Okay, so in that case, with just a short amount of time left at the end of the meeting, I just want to cover some next steps with you. One of the reasons why we try to get a little bit of interaction from people is to help influence what we do at our next event. Now, there's a separate event that we're hoping to hold sometime in January, February, where we hope to deliver some basic training around research to people in public health. More information on that will be sent out through the CHAMPS links that we have with you. And we will also have another of these sorts of meetings in March. Obviously, as ever, we will, as I've said before, send out the slides, etc., people's contact details, so that you can actually get back in contact. I'd advise you also to please look at the CHAMPS website anyway, because as and when we identify new opportunities in that sort of research arena, we put them on the CHAMPS website, or we include them in the CHAMPS on the CHAMPS newsletter that goes out as well. The other thing that I just wanted to say to people is that some of the things that have come out today would suggest that we need to broaden the links with academia and look at how we can work more with our academic partners that we've identified through the hub to just try and move towards understanding a bit better how we can actually get to the point where we've got perhaps embedded researchers either working from public health in the universities, or indeed from the universities in public health departments. I think the cost of living element's a really interesting one, and there's certainly interest across the piece about that, and how can we perhaps do some collaborative work. And the final thing that I think is quite, I suppose, two things to say. Number one, the LA Spark opportunity is advertised every so often. What's interesting is the opportunity is literally, I think it's tomorrow possibly, or maybe even today, that last opportunity is there, but it is likely to come out again. And so I would suggest that people look out for that opportunity. And the other thing is that as directors of public health or consultants in public health, or indeed public health practitioners, there's an important conversation to be had about developing the staff capacity, be that time, funding, etc., in order to actually focus on research. We need to do research, so we need to find the time and opportunity to do that within teams. So on that, I'm going to say thank you to everybody for attending. Please look out for additional information. There's lots of links that I'm seeing that are being posted in the side, and have a lovely rest of your afternoon. Thank you.